Hi there, how are you? My name is Naomi Judge. I'm a naturopath and clinical nutritionist, and I help women connect the dots between their health, happiness, and hormones, particularly help women with PMDD and severe cyclic mood symptoms within that luteal phase. So we're looking at that phase of the cycle from ovulation to your period. So this is generally day 14 up to day 28. I'm looking at how histamine, neurotransmitters, nutrients, diet impact this phase in your cycle. And today I'm going to be talking about B6. B6 is a super important nutrient. It's known as pyridoxal, it's known as P5P, and you want to be taking the P5P form, you want to be taking the activated form. B6 is so important. We use it all the time for hormonal health. We use it to support progesterone levels. We use it for various symptoms like water retention. It's super important. It helps with amino acid metabolism. It helps to make new amino acids and proteins through gluconeogenesis. It helps to make fatty acids. It helps to break down carbohydrates. It also helps to make neurotransmitters, so it helps to make dopamine, serotonin, glycine, glutamate. It supports DNA function, it supports your immune function, and it helps with ATP, which is how we make energy in our mitochondria. Lots and lots of functions, so it's very important. If you get your blood, some red flags that B6 might be low. Red flags could be high homocysteine. Homocysteine often raises when we've got low glutathione, when we've got SIBO, when we've got MTHFR, when we've got heart conditions, low B12 and low B6 and low B9. So if you've got high homocysteine, you want to be looking at your B vitamins and particularly B6. If you've got high urea, again, that could be a symptom of MTHFR, it could be dietary, it could be liver, but also low B6 can be a reason why you have high urea. And lastly, elevated CRP, C-reactive protein. If this is high in your blood, then this is an indication that there's some inflammation somewhere in your body. It could be your gut, it could be your liver, could be the kidneys, but you want to be looking at your Bs because low B6 can cause elevated CRP. And then some common symptoms can be red rashes on the skin, cracks at the side of the mouth are a biggie, red cracked dry lips, also your tongue. So we have these small papillae on our tongue, which are our taste buds, and if we've got low B6, sometimes we get that smooth, inflamed, sore, red tongue. So you want to look at that. Another one is peripheral neuropathy, which is common in diabetes, tingling and pain in the peripheries. So that can also be a symptom of low B6. And it's very common for those on insulin and having diabetes to need to supplement with B6. But today I want to talk about B6 and your cyclic moods. I want to focus on a couple of things. I want to focus on a couple of studies that have been done to show that B6, one, can help depression. So B6 can help lower depression, and it can support you with low moods, particularly cyclic low moods. B6 has also been shown to support with symptoms with PMS symptoms. So PMS symptoms including anxiety, including depression, including water retention. So these are cyclic mood symptoms associated with water retention as well. And B6 combined with magnesium have been shown to reduce water retention. So that's 250 milligrams of B6 combined with 250 milligrams of magnesium combined with 50 milligrams of B6 taken for 2 months has been shown to reduce those PMT symptoms, particularly anxiety, depression and water retention. So if that's you and you get the water retention with those mental emotional symptoms, maybe you want to look at that combination. Long-term studies as well have been done, taking 200 milligrams of magnesium and 50 milligrams of B6. Longer term studies have shown that taking it long term over 2 months can be beneficial on your cyclic moods and your PMT, PMS symptoms as well. For depression and low moods, you want to be looking between 50 and 100 milligrams of B6. It's been shown that that dosage can help with PMT and anxiety. And also combining your B6 with calcium has been shown to support with your anxiety and depression symptoms as well. Taking the calcium obviously away from magnesium, because they do interfere with one another, can help. But calcium, like magnesium, is also quite a relaxing nutrient as well. Calcium helps with sleep. It helps your nervous system, as well as helping your bones, your teeth, your nails, and your nail health. It helps with the nervous system. So sometimes when we take magnesium, because we feel magnesium is going to help with our sleep, our insomnia, our anxiety, in fact we need calcium. So just make sure you're not overdosing on magnesium and neglecting calcium, because the calcium can really help. And particularly with those PMT and depressive symptoms, calcium coupled with B6 can be very beneficial. I want to talk to you about something that I've noticed, and that's Pyrrolles, which is Pyloria, which is known as mauve factor. I've noticed that women with this have extreme symptoms, extreme cyclic mood symptoms, particularly rage and anger. And no matter what they do, they can work on their nutrition levels, they can work on their diet, they can work on somatic level, but no matter what they do, they can't seem to get further. It seems these cyclic moods get somewhat better and they improve a little bit, but then this rage and this anger will kind of rise up from nowhere. And this is a huge sign of Pyloria. Pyloria essentially is a deficiency of B6 and zinc. And what this means is heavy metals and copper can rise. And we know how copper influences candida. It can cause a candida overgrowth. And we also know that elevated free copper can cause more estrogen in the body, so it can impact your hormones in that way. But it's associated with explosive anger, real anger. If you find you're one of these women who have cyclic mood symptoms and you just can't get past this explosive anger, I would highly recommend that you have a look at Pyrrolles, you have a look at Pyloria, you have a look at mauve factor and see exactly if this is what is going on for you. There's lots of information out there. I've actually created a checklist just for you that you can download on Pyrrolles. And the checklist goes through all the most common symptoms like nausea in the morning, inability to eat in the morning, excessive stretch marks, white nails, white spots on your nails. All of these can be signs of Pyloria. So if you go through this checklist and you're ticking yes to a lot of these symptoms, then this is a good clue that this might be an issue for you. You find it's very common to obviously have the anger, the cyclic mood swings, depression, anxiety, sleep disorders, and even ADHD, ADD can be a symptom of Pyloria. So it's definitely worth having a look at that and downloading my questionnaire. But what we find with Pyloria is not zinc on its own or B6 on its own doesn't really do the whole trick. So you have to do a nice combination, and you want to be doing this kind of combination for more than a month. You want to be supporting yourself. So obviously you'll be low in zinc if you've got Pyloria. So you want to be doing about 50 milligrams of zinc a day. You don't really want to be going higher than that yet, because if you go too high on the zinc, what it starts to do is it starts to kind of cause a down. It causes all your copper or heavy metals to load into your body, into your blood supply, and then your body has to deal with it. This can actually worsen your symptoms. So you want to go with a higher dose, but you don't want to go with a super high dose that's going to give you negative symptoms. So you want to go with a lower dose over a period of time. So 50 milligrams of zinc coupled with about 50 milligrams to 100 milligrams of B6 And then what we're going to do is we're going to couple that with evening primrose oil, 1 gram twice a day. This combination has been shown to significantly reduce Pyloria symptoms within the group over about 4 weeks. So you want to be taking it longer, but how great that within 4 weeks you might be able to notice that your symptoms have lessened, particularly this anger symptom. And obviously it will have a knock-on effect with everything else. If you're trying to conceive, it's going to make you more fertile. If you want to improve your skin, if you want to balance your hormones, it's going to have a knock-on effect with everything else. The beautiful thing about the B6 and the evening primrose oil is they synergistically support zinc to absorb. And so one of the issues with Pyloria is actually that absorption, not being able to absorb the zinc. So these help to absorb the zinc. And obviously zinc helps so many other things as well. You know, we need zinc to absorb iron. So if you've got low iron or low ferritin, then you're going to be experiencing symptoms of anemia, but also that can cause anxiety, heart palpitations, insomnia, restless leg syndrome when we've got low iron. So getting your zinc levels up is going to help with ferritin and with iron as well. So it's going to have a knock-on effect and a domino effect on so many other processes in your body and improvements elsewhere. So I highly recommend, if you've got Mo Factor, if you've got Pyloria, that combination is a great combination for cyclic mood swings with anger and explosive moods. And if you get anger and explosive moods anyway, you can download my checklist and just see if the other symptoms of Pyloria are associated with what you feel and how you feel throughout the month as well. So those are what I wanted to look at today in terms of the Pyloria, because that's a biggie. And then B6 coupled with the magnesium, B6 coupled with magnesium, and then for Pyrroles we're doing B6 with zinc with EPO. So those are the important ones I wanted to cover with B6 today, how it can support you, how it can support your monthly mood swings, depression, anxiety, and particularly explosive mood swings. Now, please remember, B6 is a nutrient. You can take too much, so you don't want to take too much. I would always advise you to talk to your practitioner, talk to your general practitioner, and just ensure that it doesn't interact with any medications that you are on. Thanks for listening. Please ask any questions below and download my Pyloria checklist to see if these symptoms relate to you and if you do need to be taking the B6 with the zinc with the evening primrose oil. That's it for today. Bye bye.